Awesome sauce. Hello, everyone. How are you? We are so excited to have this July session of the AATW. We're looking forward to sharing some great information and updates. All relevant information will be pertinent to the balance of state as well as Maricopa County. As always, the chat is available for questions, and we have someone standing by to answer those questions. And let me introduce you to my amazing team. We have our new HMIS manager, Miss Stephanie Crum. I have my business analyst, Curtis Hahn, and I have my one of four amazing HMIS program specialists, Stephanie Crater, Michael Sheriff, and Dakota Leonard, and me, Alexis. So let's go ahead and get into the meat and potatoes of this July session. So we're going to share with you the purpose of the webinar. We're going to do a few webinar reminders. We have a small announcement, and I'll do that announcement. Then we'll have an interview with Stephanie. We'll have our data quality break, and then we'll have an amazing training by Curtis with regards to racial disparities and the dashboard that he's been working on diligently. And it'll have information for both parties on the line and agencies. Yay.
Okay. Hello, everyone. My name is Michael Sheriff. I am HMIS support specialist. I suppose we are introducing, if we're not introducing anyone. Let's start with the webinar purpose. The purpose is this team will communicate changes to the system or workflows, provide ongoing training to the HMIS software, review in-system reporting functionality, review and enforce the HMIS data quality, HMIS security, and the HMIS privacy plans, and of course, discuss how HMIS data is used in the community. And thank you everyone for joining.
Trying to find the mute button. All right, so we have a few webinar reminders. The first one is we want to share any relevant information with appropriate staff at your agency. So anything that you're learning, make sure that you take it back and report with the rest of your staff. Ask all questions using the Q&A function down at the bottom of the screen. You can just click on it and type in like a chat box. Number 3, attendance is collected by program. Number 4, webinar recording and the notes will be sent out by Monday, August 9th. So just be on the lookout for it after that if anybody would like to watch the live webinar recording. And then Friday, August 13th is the deadline to complete the video and quiz that goes with the webinar. So if you have any questions, just put them in the Q&A. Otherwise, I'll turn it back over to the team.
Before we get into the interview, the only announcement, the website is live, and what we anticipate having moving forward is the AATW links for the previously recorded webinar, as well as the quiz will be available on the website. We're going to test that out this go round, but we're also going to send it out traditionally, but starting officially for September, that is how the process will be. You'll be able to just access it if you missed it or if one of your team members missed it directly from our new website. And Stephanie and I are going to get into an interview. Are you ready, Stephanie?
Sure.
All righty. So as a former agency admin lead, which report was most useful for you making data-informed decisions?
Well, there was a lot of different reports that I used, but I think the one that was the most useful to me was running entry exit report on my specific program. From that, I was able to tell a lot of different information, who completed the program, who maybe fell out of contract, who completed into housing like PSH or Rapid. I could tell where anybody went. I could also calculate length of time, how long they spent in my program. So it was pretty useful just for some outcomes. And also just reporting back to funders as well.
Thank you. What is one goal for your current role in HMIS to support the balance of state in Maricopa County?
Ooh, that's a good one. So I'm still kind of new to have a lot of concrete goals, but I do have some visions that I think I share with the director of HMIS, Ty Rosensteel, about bringing a statewide coordination to both balance of state, Maricopa, whether that be a statewide system, database, or whatnot, but somewhere for balance of state and Maricopa to be able to communicate seamlessly. I think would be a big stretch goal.
Amazing. Okay. Now, what are two best practices regarding service point that you could share with the rest of the agency admins?
Yeah, sure. So I think two of the best practices for HMIS, the first one is if you're encountering someone for the first time, especially for navigators, outreach, case management, make sure that you're checking the HMIS database to make sure that they don't already have a profile created. A lot of times in the hurry, we just create multiple profiles, but you can imagine if a client had two profiles and two agencies weren't aware of those, one maybe uploaded documents to one profile but not the other, but that could really hinder a client in their search for housing or any other services. So just do that quick check, make sure they don't have a profile already, and that way we can reduce those duplicate tickets or the duplicate profiles. The second one, I had this written down. What is the second best practice? Remind me, Alexis, because I know we talked about this. Oh, yes.
Oh, client data. Thank you. Client data
Yeah.
within tickets.
Yeah. So another thing, and this is part of, HMIS ethical guidelines and all of that good stuff. And especially if you're a HIPAA agency, that this would be really important. But when you're filling out tickets for the help desk, whether it be for a client level assistance or what that is, we want to make sure that we don't put any protected health information in that ticket, just HMIS numbers. We don't want anybody's social or name or diagnosis or any other information getting out of there, because the HMIS ticketing portal doesn't have the same kind of protections, privacy protections that you might in an encrypted email, for example. So we just, as a best practice, don't put any client identifying information into a help desk ticket. Just put us the HMIS number and we can take it from there.
Amazing. Thank you, Stephanie Crum, for taking the time with us to get a little bit of your background and giving some insight to your role currently and what you did previously. So don't forget, no identifying markers in the tickets, and to double check if the client is already in the HMIS system so we can reduce the number of client merges and tickets. We appreciate you. Thank you.
Hello, everyone. I just wanted to briefly talk about a change that is occurring to the by name list that affects the current living situation sub-assessment, and making sure that we're updating specifically clients who have an institutional setting. The update to the by name list, which will be included to those in the distribution list on Monday. All the updates will be included in there in that email. But institutional clients in an institutional setting are going to be able to be pulled onto the by name list if they meet certain criteria. And I just want to make sure that these are getting updated correctly. Most who updated are going to be street outreach projects. And what you're going to want to update is all applicable fields. And if it's an institutional setting, you have to complete the additional questions every time you're doing this update. When to update is every single client contact. Where to update, updates can and should be made through the entry exit tab for the relevant period of a client's stay. So whether that's at entry, at exit, or an interim update. This is important, like I was saying, because the current living situation is critical to keeping clients in the by name list. It needs to be as current and accurate as possible. I'm going to show you a brief demo of sort of what I'm talking about, and so you can see it in the system. So I have Service Point up here, and on Service Point, I'm on the test client, and I already have this entry created for a couple weeks ago for a street outreach project. I'm going to go in, and I already had this update created, so I'm going to go in and just edit the update. If you're doing it normally, you would add the interim review, select update, save and continue. And it's going to pull up the outreach universal engagement assessment or a contact assessment. And what you're looking for is this current living situation sub-assessment. I'm going to add a new current living situation. I'm going to have the date of contact, which is often the same day as you're updating the system. And I'm going to select jail, prison, or juvenile detention facility, which is an institutional setting. You'll see all the institutional settings of this handy header here, and all of these foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, jail, prison, or juvenile detention facility, long-term care facility or nursing home, psychiatric hospital or other psychiatric facility, as well as substance abuse treatment facility or detox center are all considered institutional settings. If a client's in an institutional setting and you're working with that client, what's really important is after you enter that in, you'll see here it says if current living situation falls under institutional settings or temporary and permanent housing situations, complete below. And these are the questions that are really critical to making sure the by name list is accurate and that the clients who need housing are showing up on that list, even the clients who are in an institutional setting. So for a client to show up on the by name list, client is going to have to leave their current living situation within 14 days, and that would be a yes. If this is a no or any other response, that client would not show up in the by name list. As always, it's really important that we enter the information that's accurate and not game the system in any way to try to get a client who is going to remain in jail or prison for an extended period of time. They don't need housing right away. They don't need to be on the by name list. And then the second question that's really critical to the by name list is, has a subsequent residence been identified? Under this would be, if it said yes, the client would not appear on the by name list, but if it's no, then that client is about to be released onto the streets and has nowhere to go. We want those clients on our by name list so that we have the opportunity to provide housing and prioritize our housing that's available. The other questions are also great to answer. They don't affect the by name list, but should be completed if you have that information in time to complete. Once all that's entered, you can just hit save. And that is the update. I'm sorry, it was a little bit more than a quick commercial break. It was less than brief. I see there's a few questions that have come in. Is there a DQ report that captures the fields within the current living situation sub-assessment? That's a really great idea. I don't think there is a report that's doing that yet. That's something I can look into and really try to build out something that's related to that. Sorry, thanks, Cindy. Cindy, that was a really great question. So that is it for my data quality commercial break. Can all programs update this field? It is, if you are entering the current living situation already, you can continue to do so. It's not a field that all projects are required or need to enter. Primarily, it's street outreach that enters this information, although I know there are a few outliers that aren't street outreach programs, but it would primarily be for street outreach projects. I know some within coordinated entry sometimes enter some of the current living situations, as well as a few other projects that also have it. But if you're not entering it already, this isn't something you need to worry about. If you are entering current living situations already, this is something that you should pay attention to and be ready for. Is there any other questions? Yes, if a SSO project or another project updated the current living situation, it would affect the by name list. So the by name list isn't looking specifically for street outreach updates. It's looking for any update to the current living situation. So you always want to be careful if you're entering information there that it's accurate and not overwriting information from a street outreach or another project. Do we have the presentation still? I saw a few messages pop through. Perfect. So now I'm going to talk about the racial disparities dashboard. This dashboard is available for both continuums on our AZ HMIS Tableau page. This dashboard really just gives a baseline to start thinking about equity and how we serve our communities, and wanted to make sure everyone was aware that this information exists and it's not going to be necessarily something you use every day or is really going to affect your day-to-day work at agencies, but is something as a really high level view of our system and how our system's performing, both in Maricopa and balance of state. And sorry, Stephanie, I'm going to steal the share again. I'm just being mean to Stephanie today, making her do all the work. I'm going to bounce over here. And so I already have it pulled up for balance of state. It's going to be under the system performance measures dashboard. For Maricopa County, there's a dashboard named Racial Disparities in Homelessness, and that's where you'll find the Maricopa information. On the system performance measures dashboard and balance of state, there's a couple different tabs up at the top here. You'll see this top up here on the 4th tab is racial disparities in homelessness. This dashboard is going to compare census data in the top light blue categories here of total state population, percentage of population in poverty, percentage of clients in homelessness. And the next 3 are HMIS data of percentage of clients served in emergency shelter, safe haven, and transitional housing, percentage of clients served in rapid rehousing, percentage of clients served in permanent supportive housing and other permanent housing. Right now I'm showing data for the entire continuum. What's cool about balance of state, Maricopa, this isn't available since it's only one county. You don't get this cool filtering option. You can filter for any county in balance of state. So if you are from Cochise and specifically interested in that information, you can go there, or for Coconino or any of the other counties. I'm going to keep it on the continuum for now and just really show some of the basic ideas behind this dashboard. One of the things that can be hard to know is like, what are you supposed to do with this information? Ultimately, our goal would be for these lines to be pretty much the same. So if American Indian and Alaskan Natives are making up 11.53% of the population, we would hope that that would be the same percentage in poverty and percentage of clients in homelessness, and they'd be receiving services at the same rates. So we're really looking for flat lines. What we'll see across the data for any county or either continuum is that that's not occurring. And that's no one's fault, but something that we can strive for as a community to be more equitable in how we serve clients and people experiencing homelessness. So as I scroll down, you'll see there's a lot of different, all of the different race and ethnicity options within Service Point or set up by HUD are available in this dashboard. One of the things that's interesting about Arizona is it's a very large state with a really diverse population. So if I switch to a county like Coconino, one thing we'll see is these numbers for natives pops really way up, and we can see really how many natives they're really serving in comparison to the continuum as a whole. And we'll also notice that the Hispanic and Latino population is fairly low in a county like Coconino. The opposite trend exists if we go to a county like Yuma. So let me pop over there, and we'll see that the native population is really quite low in Yuma. But if we go down to that Hispanic and Latino population, it's quite high, which is what we would expect. But I think that's a really cool part of this dashboard is if you filter it for counties, you can really see how the population and racial diversity of the state and where we're located affects really who we're going to be serving and maybe who we focus on to make sure that we're being as equitable as possible. I don't see any new questions about the dashboard, just so that you guys can see it real quick. The Maricopa one is right here, Maricopa Racial Disparities in Poverty. And like I said, there's no filtering option, but what we'll see is the same dashboard with the same metrics from census data, as well as the same metrics from HMIS data. And as you scroll down, you can see some of the disparities that exist within Maricopa. One of the primary ones that we've noticed and is really cool from my end is anecdotally, we've been talking about how Black or African-American people don't receive proportionate services. And now we sort of have some data that backs that up. And it's something that's been known for a long time and something that's really true across the country. Systems and homeless systems that Black and African-American people experience poverty and homelessness at a disproportionate rate, and that they don't receive services, especially permanent sort of housing, at the same rate as some of the other white or other races. I think some of this is really interesting, and I can share a link here in the chat, and I'll also try to make sure that gets sent out with all of the notes from today's project. So let me jump back here. I'll grab a link for you. Send, and then that is what I had for the racial disparities dashboard. And if there's no questions, we'll continue on with our meeting today. Thank you.
Okay, thank you so much, Curtis, for sharing that new dashboard. That's all the announcements we had today. So thank you so much for joining us. Your feedback is very important to us, so please remember to answer the 4-question survey. We will be sending it out to your email within the next 30 minutes. And if your question was not answered today, please submit a ticket to the help desk. So thank you so much for coming and have a great day.
Hi, everyone.
Bye.